Pathology Final Study Video. Approximately how long does it take a wound that is healing by second intention to finish the maturation phase? The answer is 1 year or more. The PTA examines a patient's right lateral malleolus and notices a blister over it. The PTA notifies the nurse of a suspected The answer is stage 2 pressure ulcer. Approximately, how long does it usually take for a wound that is healing by first intention to initially close? The answer is 7 to 10 days. What is the role of polymorphonucleosides/neutrophils, PMNs, in the inflammatory process? The answer: first cells to ingest bacteria and debris. Second intention wounds heal best in which environment? The answer is moist. All foreign materials that cause a response from the immune system are called. The answer is antigens. Vacuum-assisted closure will. The answer is speed up the development of granulation tissue. Released within seconds of tissue injury, which chemical causes hyperemia, redness, edema, and mild warmth? The answer is histamine. When cells in the body are in a state of equilibrium with their environment, they are said to be in. The answer is homeostasis. What is an example of passive immunity? The answer is babies receiving antibodies from their mothers before birth. Which cell activates cytotoxic T cells, causes the production of more helper T cells, completes the training of B cells by assisting them to produce antibodies, and activates B cells? The answer is helper T cells. How often should a bedbound person's position be changed if the person does not have compromised circulation? The answer is 2 hours. While putting on the patient's socks and shoes in preparation for transfers, the PTA notices a deep crater with a 1/4 inch diameter on the left lateral malleolus. The ulcer has necrosis into the subcutaneous fatty layer. The PTA notifies nursing of a suspected. The answer is stage 3 pressure ulcer. Which cells roam blood and lymph looking for hijacked or cancerous cells that have been identified by B cells, to kill that cell by punching a hole in it? The answer is cytotoxic T cells. How do cytotoxic T cells differ from B cells? The answer is, T cells fight pathogens by killing pathogens directly, while B cells fight pathogens by making antibodies. Development of bone after trauma, total hip replacement, spinal cord injury, MI, etc., in areas where bone is not normally found is called. The answer is heterotopic calcification. What are the first cells to recognize a foreign body, eat it, then display bits of that foreign body on its cell membrane to present to other cells? The answer is macrophages. What do memory cells do? The answer is, patrol the area and make the immune system work faster next time it encounters the same foreign invader. First intention wound healing is usually completed in. The answer is 4 to 6 weeks. Hydrocolloid dressings are used on second intention wounds that have. The answer is minimal or dry exudate. Protein receptors produced by B cells designed to mark antigens to be destroyed are called. The answer is antibodies. Which of the following typifies an increase in size of the individual cells? The answer is hypertrophy. What is the first barrier against infections pathogens entering the body? The answer is skin. The PTA examines the olecranon area of a patient's left elbow. The skin is intact, but a bit warmer than the surrounding area, and the patient is complaining of discomfort at this site. The PTA notifies the nurse of a suspected. The answer is stage 1 pressure ulcer. How do human diseases caused by bacteria and diseases caused by viruses react to antibiotics? The answer is bacterial diseases respond to antibiotics and viral diseases do not. Which cell raises the alarm that tells other immune cells that there is a problem by releasing cytokines, chemical messengers? The answer is helper T cells. Autolytic dressings are occlusive so that the The answer is, WBCs in the body fluids can phagocytize the necrotic tissue. Cells can change from one type of cell to another. This is known as The answer is metaplasia. Which fluid is rich in protein and inflammatory cells? The answer is exudate. In which type of immunity is a cell produced that is specific to an antigen, travels through blood and lymph, and has memory? The answer is acquired immunity. Mature scar tissue is composed of. The answer is type 1 collagen fibers. Alginate dressings are used on second intention wounds that have. The answer is excessive exudate. Hallux valgus deformity is also known as. The answer is bunion. The PTA instructs the person with spondylolisthesis in exercises. These consist of. The answer is postural re-education and a focus on abdominal strengthening. A PTA prepares a patient recovering from a cemented total hip arthroplasty for discharge from short-term rehab. The patient is 70 years old, WBAT, and resides alone. Which of the following pieces of adaptive equipment would not be necessary for home use? The answer is sliding board. The PTA is correct in educating the patient with spondylosis in all the following except. The answer is educate patient to avoid spinal flexion strengthening exercises and concentrate on lumbar extension strengthening exercises. Which of the following signs is not indicative of osteoarthritis? The answer is heterotopic ossification. A spinal orthosis or brace is the treatment of choice for scoliosis, that is. The answer is 20 to 40 degrees. Leg calf Pertus disease, avascular necrosis of the proximal femoral epiphysis, causes the head of the femur to. The answer is flatten or collapse. After posterolateral hip replacement arthroplasty, the patient should not. The answer is flex the hip past 90 degrees, adduct the hip beyond midline, or internally rotate the hip beyond neutral. The treatment for the child or adolescent with leg calf Pertus disease is. The answer is wearing a brace for several years that keeps the hip in abduction and internal rotation during ambulation and rest. What are the expected goals after a regular total shoulder arthroplasty without rotator cuff injury? The answer is, return to most functional activities with limited strength, 4 out of 5, with passive shoulder flexion 0 to 140 degrees, abduction 0 to 140 degrees, external rotation 0 to 60 degrees. All the following signs will be seen on a radiography of a person diagnosed with osteoarthritis except the answer is, loss of significant bone mass. After an anterior or anterolateral surgical hip replacement, the patient should not The answer is, flex the hip past 90 degrees, adduct the hip beyond midline, externally rotate the hip beyond neutral, and extend the hip past neutral. What are the shoulder precautions for a total shoulder arthroplasty? The answer is, no movement that combines shoulder extension, adduction, and internal rotation. The life expectancy of someone with Marfan syndrome may be shortened due to The answer is, heart or blood vessel connective tissue abnormalities. After surgical placement of Harrington rods, how should a person with corrected scoliosis be taught to roll in bed? The answer is, log roll. How would you describe bone that is osteoporotic? The answer is, honeycombed and fragile. What is the knee flexion assisted range of motion optimal long-term goal for someone who has had a total knee arthroplasty? The answer is, 0 to 120 degrees. Conservative treatment for torticollis, Rhineck, caused by tightness of the SEM consists of The answer is, gentle sustained stretching which rotates the head towards the affected side and laterally flexes away from the affected side. Which of the following is not a medication used to treat osteoporosis? The answer is, cortisone. The clinical picture of osteoarthritis includes all the following except The answer is, morning stiffness that lasts several hours. What task will the PDA do for the infant or child with osteogenesis imperfecta? The answer is, educate caregivers and parents how to safely handle the infant or child to reduce risk of fractures. Which of the following is not best practice after a total hip arthroplasty using a posterior approach? The answer is, lean forward, nose over toes when rising from a chair. Which of the following activities help to slow down or reduce bone mineral density loss caused by osteoporosis? The answer is, brisk walking, low-impact weight-bearing exercises, and strength training multiple times per week. What is the most appropriate treatment for a baby with developmental dysplasia of the hip or congenital dislocation of the hip? The answer is double hip spica cast or Pavlik harness for several months with the hips maintained in an abducted position. The clinical picture of a person with cervical or lumbar spondylosis includes all the following except the answer is decreased blood supply to the cervical or lumbar spinal joints. Osteogenesis imperfecta is a disease caused by the answer is interference with type 1 collagen synthesis. Heberden's nodes and Bouchard's nodes are characteristic of the answer is osteoarthritis. Which of the following statements regarding spondylolysis is incorrect? The answer is, it usually occurs at the L1, L2 vertebrae. Which activity should the person who has either had a total hip arthroplasty or total knee arthroplasty not do after healing? The answer is high-impact aerobics, football, soccer, and jogging. People with severe osteoarthritis of the hip may walk with a Trendelenburg gait pattern. When a person is walking, the person's the answer is pelvis drops toward the leg that is off the ground, dropping away from the affected hip. In which stage of bone healing will a hematoma be present? The answer is inflammatory stage. A sprain refers to a pull or tear of what structures? The answer is ligaments. To minimize deformity, the person with active rheumatoid arthritis flare-up should be encouraged to the answer is use splints to protect the involved or affected joints. At what stage of complex regional pain syndrome is the use of physical therapy most successful in improving the condition? The answer is stage 1 acute warm phase. What rheumatoid condition may also include Felty syndrome, skin nodules, and Raynaud's phenomenon as non-joint pathological changes? The answer is rheumatoid arthritis. In which phase of healing will both soft callus and hard callus be present? The answer is reparative phase. Contact sports are contraindicated for the person with what disease? The answer is ankylosing spondylitis. A bamboo spine is a classical sign of ankylosing spondylitis. A 20-year-old male patient presents with minimal motion in his spine. Hip range of motion is severely limited to 0 to 40 degrees hip flexion bilaterally. Strength of lower extremities is 3 out of 5. Upper extremity range of motion and strength are within normal limits. Postural deficits include thoracic spine kyphosis, flattened lumbar lordosis, forward head position and flexion of hips. The patient rates his pain in the lumbar spine and SI joints as 8 out of 10. This person most likely has The answer is ankylosing spondylitis. A 40-year-old woman is examined. She complains of severe pain in both hands, sausage fingers, reduced motion of distal interphalangeal joints, minimal pitting of the fingernails, and inability to pick up the lightest weights including a towel to dry the dishes. She also complains of difficulty walking and climbing stairs, pain in both feet and severe stiffness in her lumbar spine that made it difficult to get moving in the morning to go to work. Upon examination, she had a patch of psoriasis under the hairline at the occiput. Which type of rheumatic disease is this person likely to have? The answer is psoriatic arthritis. In which phase of bone healing will granulation tissue begin to form? The answer is inflammatory phase. Which statement regarding complex regional pain syndrome is true? The answer is, the signs and symptoms include severe pain, edema, and skin changes including excessive hair growth, sweating and loss of wrinkles in the skin of the affected limb. Which statement regarding rheumatoid arthritis is true? The answer is, rheumatoid arthritis is an inflammatory, systematic, connective tissue and autoimmune disease. Disease-modifying antirheumatic medications, such as cyclosporin, methotrexate, and gold salts, and biologic drugs, such as Enbrel, Humira, and Remicade, may be medications of choice for all the following conditions except The answer is osteoarthritis. Which of the following signs and symptoms is indicative of psoriatic arthritis? The answer is pencil-in cup deformity of the fingers and pitting of fingernails. What does pannus consist of? The answer is an invasive layer of finger-like tissue within the synovial joint consisting of inflammatory cells that destroys the joint. Rheumatoid arthritis is often associated with other syndromes and phenomena such as Sjogren's syndrome. Which description best describes Sjogren's syndrome? The answer is dry eyes and photophobia. Which of the following is not a recommended early intervention for complex regional pain syndrome? The answer is passive range of motion to the involved extremity. Which statement regarding rheumatoid arthritis is not true? The answer is early morning stiffness generally lasting less than 30 minutes. The person with complex regional pain syndrome should be encouraged to The answer is actively move the extremity. A PTA treating someone with ankylosing spondylitis focuses on The answer is extension of the spine and chest expansion exercises. A 35-year-old woman is examined. She complains of pain and stiffness in her fingers, difficulty swallowing food, extreme early morning stiffness, pain in multiple joints throughout her body, dry eyes and mouth, and feeling weak. Her hands are in a claw-like position, and she is unable to extend her fingers fully. Her forehead and cheeks appear shiny, and her mouth has a pursed lip appearance. She complains of pain in the temporomandibular joint and has limited mandibular movement. The symptoms have been progressing for approximately 4 months. What disease is she likely to have? The answer is scleroderma. Which of the following is not a contraindication for patients with rheumatoid arthritis? The answer is exercise program adjusted to pain tolerance and fatigue. All the following statements regarding juvenile forms of rheumatoid arthritis are true except The answer is rheumatoid arthritis only affects one joint, usually the hip. What type of medication is prescribed for a person with fibromyalgia? The answer is SSRI antidepressants such as Cymbalta. Physical therapy for someone with fibromyalgia should focus on The answer is aerobic exercise and strength training within patient tolerance. A disease characterized by a combination of signs and symptoms including photosensitivity, a malar rash of the face, butterfly rash, fatigue, weight loss or weight gain, Raynaud's phenomenon, arthritis-like symptoms in fingers, feet, knees, wrists, and progressive internal organ involvement is The answer is systemic lupus erythematosus. What signs and symptoms are typical of rheumatoid arthritis? The answer is Ponnus formation in the joints, and boutonnieres and swan neck deformities. Which of the following characteristics is indicative of fibromyalgia? The answer is, out of a possible 18 points on the body, 11 are hypersensitive to palpation. Even after a year or more post-injury, a sprain may only achieve The answer is 50% of its original strength. In which phase of bone healing will hard callus be present along with the process of the bone returning to its original shape? The answer is remodeling phase. What cardiac surgery is indicated when a major coronary artery is fully occluded? The answer is coronary artery bypass graft. Which of the following statements regarding the left atrium of the heart is true? The answer is, it receives oxygenated blood from the lungs via the pulmonary veins. Which of the following statements is false for treating a person with peripheral vascular disease? The answer is, the foot end of the bed should be raised when sleeping. On an ECG, which wave represents depolarization of the atria? The answer is P. Atherosclerosis is the most common cause of all the following except. The answer is valvular stenosis. After a heart attack, the ischemic cardiac muscle dies and neurotic tissue is replaced by scar tissue. What does the rest of the heart do to make up for the lost tissue function? The answer is hypertrophies. A peripheral vascular disease that affects smokers and tobacco chewers ages 20 to 40, which may lead to finger or toe amputations if the use of tobacco is not stopped, is. The answer is thromboanginitis obliterans. Normal cardiac output is. The answer is 5 liters per minute. Ejection fraction measures the ability of the heart to contract. The answer is 55% to 75%. The most common occluded artery, which is the cause of the widowmaker type heart attack, is the. The answer is anterior descending branch of the left coronary artery. What describes ascites? The answer is abdominal edema. Ascites, dependent/peripheral edema, distended jugular vein, and pain under the ribs due to the enlarged liver are indicative of. The answer is right-sided congestive heart failure. Which disease is when the mitral valve cusps project into the left ventricle? The answer is valvular prolapse. What does a rate pressure product represent? The answer is heart rate multiplied by the systolic blood pressure. Which cardiac surgery is indicated for SA node dysfunction or heart block? The answer is pacemaker. Which phase of cardiac rehabilitation consists of educating the patient on lifestyle changes, teaching and practicing low-energy ADLs such as grooming, dressing, bathing and toileting, monitoring ambulation, and assisted range of motion without overhead movement? The answer is phase 1. Which of the following patients is most at risk for atherosclerosis and heart disease? The answer is a 60-year-old male with a history of diabetes for 10 years who smokes 20 cigarettes a day, has a high cholesterol level, weighs 270 pounds, and has a history of heart disease. The PTA is about to treat a patient who presents tenderness in the posterior lower leg, pain in the calf when the foot is dorsiflexed, redness in the area, and edema. The PTA defers treatment until the patient is evaluated for the possibility of The answer is deep vein thrombosis. Specialized massage and specialized compression wrapping of the extremity is the best treatment for The answer is lymphedema. What are the Berger Allen exercises used in the physical therapy treatment for? The answer is peripheral vascular disease. The patient with congestive heart failure. The answer is requires frequent rest periods during exercise or activity. What disease is when a heart valve does not fully close? The answer is valvular insufficiency. Which of the following procedures is considered invasive? The answer is cardiac catheterization. What is the disease in which a valve does not fully open is? The answer is valvular stenosis. Which of the following is a procedure that takes an ultrasound picture of the heart revealing its size, thickness of the walls of the heart, valves, and any ischemic areas of the heart? The answer is echocardiography. Which of the following is the most immediate life-threatening condition of the heart? The answer is ventricular fibrillation. Your 60-year-old male patient experiences periodic pain in the upper chest and left shoulder when he overexerts himself, is under emotional stress, or is in places where the temperature and humidity are high. He has had this problem for several years, and the pain is relieved with rest and taking a nitroglycerin tablet. The most likely reason for these symptoms is The answer is angina pectoris. What disease is intermittent claudication a symptom of? The answer is peripheral vascular disease. On an ECG, which wave represents the repolarization of the ventricles? The answer is T. Sternal precautions after coronary bypass graft consists of all the following do nots, except. The answer is do not cough. On an ECG, which wave represents the depolarization of the ventricles? The answer is QRS. As the patient's aerobic fitness improves, the rate pressure product. The answer is decreases. A person with severe varicose veins should follow all the following advice except. The answer is participate in high-impact aerobics 3 times or more per week. Hypertension puts a person at risk for developing all the following except. The answer is varicose veins. What are central cyanosis, cough, dyspnea, and pulmonary edema indicative of? The answer is left-sided congestive heart failure. Sudden weakness or numbness of the face or extremity on one side of the body, sudden loss of vision in one eye, sudden difficulty speaking or understanding speech, and or unsteadiness or sudden falls are warning signs of. The answer is cerebral vascular accident. What does an atheroma, or arteriosclerotic plaque, consist of? The answer is foam cells. The perceived rate of exertion is a subjective scale used to determine a safe level of intensity of activity for patients with cardiac problems. Which of the following statements is true? The answer is, during exercise, the RPE, as well as the vital signs and any observable signs of discomfort should be monitored. Your patient relates being able to walk for about 15 feet and then experiences severe pain in his posterior lower leg. The most likely explanation is the answer is intermittent claudication. What are the S1 and S2 heart sounds created by? The answer is closing of heart valves. Central cyanosis, cough, dyspnea, and pulmonary edema are indicative of. The answer is left-sided congestive heart failure. At which level does the bifurcation point of the trachea lie? The answer is sternal notch and fifth thoracic vertebrae. Which condition requires the patient to take pancreatic enzymes to improve intestinal absorption of fats and proteins? The answer is cystic fibrosis. What is chronic bronchitis defined as? The answer is, a productive cough presents for 3 months of the year for 2 or more consecutive years. What is the medical intervention for a pulmonary infarction? The answer is, anticoagulant medications with bed rest. The PT asks you to collect data to determine the chest excursion of a patient with emphysema. How do you come up with the correct number for chest excursion? The answer is, subtract the number of inches measured for inhalation with the number of inches measured for exhalation. When teaching diaphragmatic breathing exercises, what does the PDA need to ensure the patient understands? The answer is, the diaphragm contracts and descends/lowers during inhalation. How many METs does it require for a person to be awake and sitting? The answer is 1. What is the main common cause of chronic obstructive pulmonary disease? The answer is cigarette smoking. What is the condition characterized by intestinal malabsorption with foul-smelling feces, a productive cough, failure to gain weight, clubbing of fingers and salty skin? The answer is cystic fibrosis. What is a condition in which smooth muscle of the bronchiole walls contract and spasm, causing production of excessive mucus when exposed to a trigger such as smoke, animal dander, exercise, or extreme temperatures? The answer is asthma. Which of the following may cause pneumonia? The answer is all the above. What type of sputum is thick, yellow, or green, may be rust-colored due to presence of old blood? The answer is purulent. Which of the following is not an abnormal or adventitious breathing sound? The answer is vesicular sounds. Pink puffer refers to someone with what disease? The answer is emphysema. Which of the following is not a classic clinical manifestation of emphysema? The answer is barrel chest. Blue bloater refers to someone with what disease? The answer is chronic bronchitis or type B COPD. Pneumothorax is a life-threatening condition of. The answer is when the lung collapses. Normal ventilation perfusion ratio is. The answer is 80%. Which of the following is not part of the acute portion of an asthmatic episode? The answer is expectorating sputum. The accessory muscles of forced inhalation include all the following except. The answer is rectus abdominal and quadratus lumborum. Which of the following is not a classic clinical manifestation of chronic bronchitis? The answer is barrel chest. What is the importance of knowing a patient's ventilation perfusion rate? The answer is helps the physician and physical therapist determine if the patient requires supplemental oxygen. The surgical removal of a whole lung is called a. The answer is pneumonectomy. Which condition results in permanent dilation of bronchi and bronchioles caused by blockage or infection? The answer is bronchiectasis. Adult respiratory distress syndrome is. The answer is rapid lung failure that is often fatal due to multi-organ failure. Which of the following has the highest MET level? The answer is bicycling more than 10 miles per hour uphill. Forced expiratory volume is usually reduced in all the following except. The answer is the common cold. Sputum that is white and opaque, often found in pulmonary conditions with no infections such as asthma and chronic bronchitis, is called. The answer is mucoid. The PDA observes a patient sitting quietly in the gym prior to his therapy session. Which of the following clinical signs could indicate a chronic pulmonary problem? The answer is 1:2 ratio of inspiration to expiration. Sputum that is bubbly, white or pink colored, often found with pulmonary edema, is called. The answer is frothy. An incentive inspiratory spirometer can be used to prevent. The answer is atelectasis. The condition most conducive to contracting pulmonary tuberculosis infection is The answer is prolonged exposure in an enclosed space. How is tuberculosis mycobacterium transmitted? The answer is inhaled airborne droplets. Which of the following statements best explains chronic bronchitis? The answer is a condition characterized by excessive pulmonary secretions present for long periods of time that result in blockage of the small bronchi and bronchioles. What is the most reliable way to measure exercise tolerance in a patient who is taking a beta blocker? The answer is rate of perceived exertion. The PT asks you to collect data to determine the chest excursion of a patient with emphysema. What anatomical landmark will be used to take the measurement? The answer is xiphoid process. Accepted normal SpO2 ranges for individuals with no pulmonary disease are The answer is between 95% and 100%. How long should a person with active tuberculosis stay on medication before the disease is considered cured? The answer is 1 to 2 years. How does a person with an obstructive airway disease such as asthma or emphysema increase the volume of air exhaled? The answer is breathe out slowly through the mouth using pursed lips. What are the pathological changes that occur within the respiratory system in emphysema? The answer is alveoli are inflamed, producing enzymes that destroy the walls of the alveoli, leading to less gas exchange. Temporary skin grafts taken from another person, usually a cadaver, are called The answer is an allograft. Which is the most fatal form of skin cancer? The answer is malignant melanoma. Highly active antiretroviral therapy, HAART, is used to suppress the replication of the causative virus in which condition? The answer is human immunodeficiency virus, HIV. HIV/AIDS is transmitted through The answer is intimate contact with blood products, infected semen, or infected vaginal secretions. What type of cell does HIV attack? The answer is T4 lymphocytes. One sign of Lyme disease is the answer is unilateral arthritis of large joints, especially the knee. Methicillin-resistant Staphylococcus aureus, MRSA, is usually spread through the answer is skin-to-skin contact or openings in skin and object-to-skin contact. In 1955, the United States government ordered the polio vaccine being produced by Qatar Laboratories to be withdrawn from the market because it was contaminated with the answer is a live virus. Foul-smelling diarrhea occurring more than 3 times per day for at least 2 days in a person who has recently taken antibiotics may indicate the answer is Clostridium difficile. What hand hygiene should be used to prevent Clostridium difficile and methicillin-resistant Staphylococcus aureus from being spread? The answer is washing hands with soap and water. Clostridium difficile enters the body through the answer is fecal-oral route. Lyme disease is caused by the spirochete Borrelia burgdorferi and is transmitted to humans by deer ticks. Which of the following statements about Lyme disease is false? The answer is the disease is treated with an 8-day course of antibiotics and antimicrobial medications. Nausea, vomiting, loss of appetite, fatigue, abdominal pain, diarrhea, fever, joint pains, dark-colored urine, clay-colored feces, and jaundice are signs and symptoms of the answer is hepatitis. Where is MRSA found? The answer is all the above. Which of the following is not a clinical manifestation of methicillin-resistant Staphylococcus aureus? The answer is a rash. What is the CDC recommendation for cleanup of blood spills or body fluids? The answer is solution of 1 part bleach to 9 parts water left on contaminated area for 20 minutes. Which of the following diseases is most commonly transmitted through the oral fecal route, which is by ingesting food or drinking water that has been contaminated by the feces of someone who has this form of hepatitis? The answer is hepatitis A. A PTA is preparing to place a hot pack on a patient's lower back and observes what looks like a very red single boil that contains pus. The PTA decides not to do the treatment. The skin lesion is most likely The answer is methicillin-resistant Staphylococcus aureus. HIV can live outside the body for The answer is for several seconds. In order to prevent Lyme disease, the tick should be removed from the skin within how many hours after tick exposure? The answer is 36 hours. The increased prevalence of MRSA and C. diff is due to The answer is overuse of antibiotics. Which type of hepatitis can live outside the body for several months? The answer is hepatitis A. Which of the following is not a common opportunistic infection associated with autoimmune deficiency syndrome? The answer is influenza. Poliomyelitis enters the body through The answer is nose and/or mouth. What is the potential prognosis for hepatitis B and C? The answer is liver failure. Poliomyelitis can cause The answer is motor paralysis. Clostridium difficile spores on the hands are killed or lessened by The answer is warm soapy water. All the following physical therapy interventions are recommended for post-poliomyelitis syndrome except The answer is maximum intensity exercise. Both Jonas Salk and Albert Sabin created polio vaccines. Which vaccine became the front-runner due to its efficacy and ease of oral dosing? The answer is Sabin's vaccine. Which of the following does not have a vaccine for humans to prevent it or lessen its symptoms? The answer is West Nile virus. Choose the false statement concerning cerebral palsy. The answer is, children with cerebral palsy experience progressively increasing damage to the brain as they grow older. What medical intervention is most effective in reducing the brain damage from a stroke caused by a blood clot? The answer is, administering intravenous tissue plasminogen activator. Pelvic floor dysfunction occurs in The answer is, both men and women. Diffuse traumatic, many areas of the brain injuries are caused by The answer is, closed coup counter coup type injury. Incontinence can be treated with The answer is, all the above. Ed was admitted to the hospital with acute progressive ascending muscular weakness of the limbs, which produced a bilateral symmetric flaccid paralysis. These signs were preceded by a respiratory infection 3 weeks ago. A spinal tap reveals high levels of neuron proteins in the cerebral spinal fluid. The diagnosis is likely a condition caused by the destruction of myelin in the peripheral nerves known as The answer is, Guillain-Barré syndrome. Erb's palsy, an upper brachial plexus birth injury that causes neuromuscular damage, presents as The answer is, paralysis of upper extremity muscles resulting in shoulder adduction and internal rotation, giving the appearance of a waiter's tip position. Multiple sclerosis is a disease that attacks the myelin coating of nerve fibers in the The answer is, central nervous system. Tenodesis allows a person with a C5 spinal cord injury to do all the following except The answer is, a written text phone message. The pelvic floor consists of what muscles? The answer is, levator ani and coccygeus. Alzheimer's disease is thought to be due to The answer is, abnormal buildup of amyloid proteins which form plaques and tangles within the brain cells. What does a score of 3 on the Glasgow-Coleman scale indicate for a person? The answer is, severe head injury. What medical intervention is most effective in reducing the brain damage from a hemorrhagic stroke? The answer is, reduce hypertension and reduce the brain bleeding. Hydrocephalus, paralysis, usually of the legs, bowel and bladder incontinence, scoliosis, hip dislocation and club foot usually presents in The answer is, spina bifida myelomeningocele. Find a warning sign that is not indicative of transient ischemic attack or cerebral vascular attack. The answer is, sudden difficulty breathing or chest pain. Which of the following most accurately describes myelomeningocele? The answer is a defect in the development of the neural arch of a vertebra where the meninges and the spinal cord both protrude through the opening in the vertebra. Down syndrome is recognized by The answer is flattened facial characteristics and hypotonia, low muscle tone. Of the following, which is not a symptom of multiple sclerosis? The answer is blindness in both eyes. What is the hallmark of spinal shock immediately after a spinal cord injury? The answer is no motor or sensory activity below the spinal level of the lesion. A brain attack or stroke that is caused by an arterial occlusion due to a thrombus or embolism is known as The answer is an ischemic cerebral vascular accident. All the following are precautions and considerations when treating a patient with a traumatic brain injury in the ICU except The answer is wear brightly colored clothing to help stimulate the patient. The best statement describing Down syndrome is The answer is a chromosome abnormality resulting from a trisomy of chromosome 21. In men, signs and symptoms of pelvic floor dysfunction may include The answer is all the above. All the following are urge suppression techniques that the PDA may use in educating the patient who is diagnosed with urge incontinence except The answer is sing happy birthday 2 times while running quickly to the bathroom. Which of the following distinguishes Lewy body dementia from other dementias? The answer is misremembering how things happened, has visual hallucinations and falls often. The PDA is rendering active assisted range of motion to the upper extremities of a patient who is 8-week status post-spinal cord injury at T5. The patient complains of a pounding headache and sweat is dripping off their face. The PDA takes vital signs. Heart rate is 105. Blood pressure is 200/110. The patient is probably experiencing The answer is autonomic dysreflexia. Cheryl presents the following signs and symptoms: absence of arm swing during gait, cogwheel rigidity, bradykinesia, and tremors at rest. She also has difficulty beginning movement, such as walking, and equal difficulty stopping and turning. She often bumps into walls as a result. Her therapist suspects The answer is Parkinson's disease. The person who cannot apply rules of social behavior, violates physical proximity, social rules essentially inappropriate, and becomes angry or irritable quickly and out of proportion. For the situation is most descriptive of a person with The answer is severe traumatic brain injury. The neurological signs and symptoms of a transient ischemic attack lasts. The answer is less than 24 hours. In women, all the following are signs or symptoms of pelvic floor dysfunction except the answer is diarrhea. The Rancho's Los Amigos assessment tool was developed to describe levels of the answer is cognitive function, ability to problem solve, concentrate and behave appropriately in people with brain injuries. What happens to muscle tissue in the person with Duchenne's or Becker's muscular dystrophy? The answer is replaced by fat and connective tissue. Which of the following neurological diseases or conditions has slow progressive muscle weakness, atrophy and paralysis of limbs, trunk and face, fatigue, but no sensory deficits? Progression may take several years, and death is due to respiratory failure. The answer is amyotrophic lateral sclerosis. What should the PDA do when the patient with a T5 spinal cord injury complains of a pounding headache, the skin is flushed, and profuse sweat is dripping from their face? Their vital signs are heart rate is 105 and blood pressure is 200/110. The answer is, find and remove the cause of the headache, sweating, tachycardia and high BP, and sit the person upright immediately. The pelvic floor, often described as a hammock, is a funnel-shaped structure. How do the muscle fibers run or attach to bone? The answer is, from the pubis symphysis to the coccyx and from one ischial tuberosity to the other ischial tuberosity. At approximately what age does someone with Duchenne's muscular dystrophy become wheelchair-bound? The answer is 7 to 12 years. Gower's sign is defined as the answer is coming to standing from the floor by using one's hands to climb up the legs. Which of the following is not a risk factor for women of developing pelvic floor dysfunction? The answer is diabetes mellitus. When working with patients with Alzheimer's disease, it is helpful to do all the following except the answer is encourage the person to accept your perception of reality. The major presentation of someone with advanced Alzheimer's disease is the answer is no memories and severe cognitive decline. Which of the following is a risk factor for men for developing pelvic floor dysfunction? The answer is prostate surgery. Someone with vascular dementia shows signs of The answer is emotional lability, laughing or crying in response to social interactions, and apathy.